Hi, my name is Jeff Ling and I'm an orthopaedic surgeon specialising in the foot and ankle. My practice is based in Randwick at Prince of Wales Private, but we welcome patients from all over Sydney and all over the state and beyond. I was born and raised in Sydney and have had the pleasure of living in all four quadrants of this beautiful city. Growing up, my dad was a GP, and because of this, I was exposed to the world of medicine and caring for patients from my earliest days. I've had the pleasure of training throughout many of Sydney's teaching hospitals, and for my overseas fellowship training, I had the privilege of spending a year in the States where I trained at the Hospital for Special Surgery in New York and the Shriners Hospital in Portland, Oregon, equipping myself with the latest techniques in foot and ankle treatment. Now, well into my second decade of practice, I continue to love every day I come to work. What I love about my work is the people I get to meet, get to know, and get to help as I take them on the patient journey. I love the wide variety of conditions and treatment options in foot and ankle surgery. It's an incredibly complex area of the musculoskeletal system with many bones, ligaments and tendons. And because I treat kids and adults, I have the privilege of treating multiple members within a family and treating and following patients from childhood into adulthood and old age. I'm particularly excited about the new developments in orthopaedic surgery, particularly in the area of patient-specific planning, which I'm very passionate about, robotics and even virtual reality. Importantly, I like to spend time getting to know my patients well, so that I can understand their needs and goals. I believe strongly in communicating clearly and making sure difficult concepts are understood by my patients so that they feel comfortable with the process and can make informed decisions. I think it's really important for a surgeon to be a good human at the end of the day. It's easy to share in patients' joys and victories, but it's harder to support them through grief and hard times as well. I've made sure I've surrounded myself with good people, including my team of practice managers, my practice nurse, my anaesthetists, physios and podiatrists that I work closely with and refer my patients to. What is critical for me is supporting the patient along their journey from the moment I meet them till the day I discharge them from my care. If you or your loved one is suffering with their feet or ankles, I really look forward to meeting you and discussing the available options. I'm confident that we can work together to improve your function and quality of life.